Hey everybody, this is Craig Isley with Limitless Physical Therapy, and one of our big goals for this year is to be able to provide more resources, be able to better connect with our patients through social media, online, and help people better navigate physical therapy, better navigate healthcare. So if you're seeing this video, please leave a comment below, let us know what kind of things you are looking for, how we can be a better resource for you, what information you like to see, because that's what we're here to try to do, is be a better resource for you. So the video today is going to be a snippet of a conversation I had with two of our newest PTs, Aaron and Padam, around patient engagement. It talks a little bit about why we feel patient engagement is so critical to patients' overall success and overall outcomes. So enjoy, see what you think, and keep an eye out for more of these videos coming. We're going to be recommitting to really helping people discover their future without limits. So I want to go into that because that's a great point. What are some of the real specifics? Because you kind of talked about some of the general aspects. What are the things that you guys are doing and find really successful that help get a patient engaged in the process of physical therapy? And you think specifics as well.
Well, usually one of the things I mention to them at the get-go is they'll probably see a therapist maybe twice a week. We usually give them a home exercise program. People don't like to do their homework, but it's an integral part of their recovery. And when you can encourage them and tell them the responsibility of that exercise program and the fact that there's 7 days in a week and we're asking them to do it once or twice a day, and when they can see the benefit of doing those exercises, not just showing up twice a week and expecting us to fix them. If they get seven days a week care, 14 times of exercise, you'll see greater gains quicker. So that's a huge component.
Awesome. So let me summarize and see if I'm understanding what you're saying. By helping a patient understand that they're only seeing us for a fraction of their overall time that they're alive.
Sure.
Them understanding, one, the importance and the role of the exercise in their progression is absolutely critical. And also then the other side is getting them to really understand how those exercises are going to address the injury that they're having, helps them really tie those pieces together for motivation and
Correct.
compliance. So they're not just, you're not just doing an exercise that we're saying, hey, do this exercise, but really at a deeper level understanding how the exercise is going to, impact you. And then, I think the other thing too that you kind of alluded to, and I think is really important, is getting the patient to feel the positive impact of the exercise. And if we can get a patient to really connect the exercise to improvement, and improvement, on the surface, we all look at pain being a real critical improvement. Now, pain can be a horrible indicator of progress, because you can be making great progress and pain still be about the same. And so whether it's, pain as being one indicator, but even going upstream as far as saying, this exercise should improve your mobility around this joint. Here's how you can recognize that. That can be a huge kind of upstream indicator of ultimately how loading this joint better is going to lead to elimination of the pain. And that can be a huge important aspect of then that engagement of the patient then being able to do the exercise. But I even say, provide us the feedback if the exercise is actually producing the results. And that makes our job so much, I don't want to say easier, but we're able to then take a few steps ahead each time the patient comes in, because instead of us saying, well, is the exercise working? Now the patient at a deeper level understands what they should be looking at to see if the exercise is helping. They can come in and I say, hey, how's the exercise going? And instead of, well, I did it, all right? They're saying, I did it and this is the result I felt. Or I did it and I wasn't feeling those results. Well, great, now I've got a huge amount of information that I'm speeding up, that I might take the first 10 or 15 minutes of the visit finding out, but if the patient's able to provide that for me, I'm able to say, is the exercise doing what we want it to do? And that level of engagement and sophistication. And, I'm not going to lie, we ask a lot of our patients, and we're trying to set a much higher bar in terms of the patient understanding what they're trying to accomplish with physical therapy. But in doing that, we're able to really produce results at a different level, because then it allows us to, use our expertise at a deeper level, a more impactful level, to really, be the champions for change. Then the patient's able to understand that change. Anything in terms of that side of it that you want to add in terms of really getting a patient engaged in the process?
So I would say, especially when they come for the eval, I think that's even the whole difference, because sometimes, they come with such with a huge trust, and for us to not only trying to find out what's causing, it's not only setting the plan, but even finding what's causing that impairment, or if that's a pain, or difficulty doing some functional task. But at the same time, when we set some plan, when we're going to see the patient next, and what's going to be our next step or approach. So that gives patient more motivation to okay, now there's something they can look ahead to, because sometimes we do some treatment, they get better, but if we don't have some plan set for the next visit, which can be challenging too, it's difficult for a patient to get engaged, and they're okay, I'm feeling better, but I don't know, is that it, or is there something that's going to come up for a longer recovery? So I think getting more engaged on what's we'll do next time, and what patients are supposed to do when they're at home with home exercise, and just giving us a feedback if that's helping or not, or if we have to modify with that, and how we're going to progress with the plan, I think.
Cool. So just to kind of summarize things, I'm hoping that little bit of information was something that you find very valuable, you can start using. And again, at the end, smash the like button, leave us a comment, let us know what other types of information you'd like to see, and keep an eye out, because we're going to be giving you some really good quality information, hopefully give you some direction in your care, helps give you a little direction on how to address some of those aches and pains. Until next time, discover your future without limits.